Hi everyone. In previous video I have explained about cervical cancer vaccines, and in this video I'm going to talk on cervical cancer screening methods, its importance, and when you have to start getting the screening test done. As I already explained that once you are infected with HPV infection, it generally takes 10 to 15 years to become a cervical cancer. And here is how our screening test helps. It helps to identify the precancerous changes for which you can take the treatment before it gets converted into a full-fledged cancer. And not only that, generally the cancer cervix is diagnosed in the late stages because symptoms appear very late. And because of this screening test, we can diagnose the cancerous changes early, and early diagnosis and early treatment definitely will have good prognosis as well as improved survival rates compared to the late diagnosis and late treatment. Next, coming to the methods of screening. So there are two methods. One is pap smear test, and the second one is human papilloma virus testing, HPV testing. In both the methods, we collect cells directly from the cervix. We introduce a speculum just to open the vagina, and we collect cells from the cervix, both inside as well as outside. This is called endocervix. Through brush, we collect these cells. From the ectocervix, we collect the cells through spatula. But in pap smear testing, we see any changes in the cells like precancerous or cancerous changes in the cells. But whereas in HPV testing, we directly test for human papilloma virus, the strains which can cause the cancer, whether it is present or not. So, next is when should you get the screening test done? So, you have to start getting the cervical cancer screening test once you reach 25 years of age, and you should continue till 65 years of age. So, between 25 to 30 years age group, only pap smear testing is enough, and that too you can do every 3 years if it's normal. Whereas for 30 years to 65 years age group, you can do either you can get pap smear done at every 3 years, or only HPV testing every 5 years, or both pap smear as well as HPV co-testing, we say both together, that also every 5 years till 65 years of age. And once you cross 65 years of age, if your previous screening reports are normal, then you can stop getting the screening test done. But if it's abnormal, you have to continue your screening. Thank you.